Hi, and welcome to another episode of Hot Takes with me, the Silver Fox, and welcome to all you wonderful, intelligent seekers of truth. And if you are yet to hit the subscribe button, now's the time to do it. It's going to be an interesting year, and you won't want to miss anything. Now, we're going to start this week with the story. I did a quick sort of flash on it last night, where is likely to be changes to the way the NHS is run, and this is likely to incur charges so that it is no longer free at the point of service. This is because 17 years of SNP misrule have completely destroyed it, underinvestment and a lack of care by various ministers over the years. Nobody seems to care. And of course, Humza Yousaf has picked his latest health minister, man who is totally, I suppose, ill-suited to the job. He's never run a department as big and complex as health, and yet he's being dumped straight in and told to get on with it. And get on with it he will, but what a mess it's going to be. That's the trouble when you appoint people, because they are the latest in a long line of lickspittles and obsequious little sycophants, rather than being talented. So let's take a look to see why Neil Gray is likely to screw up health almost as badly as Matheson and Humza Yousaf, if not worse. Here goes. So Humza Yousaf has handed Neil Gray a poisoned chalice in the health brief, as the new chief told action is needed now. Neil Gray does not strike me as the sort of man for whom action is something that comes easy. He strikes me as someone who likes to sit around all day doing nothing, pretending he's important and signing off little chits to say do this, do that, do the other, without understanding the full implications. He doesn't strike me as anyone capable of running a massive, complex department filled with, self-interested parties. Certainly the medical staff within that department will be far more knowledgeable than him. He knows nothing, and yet he's expected to create this miracle of fixing the NHS before the next election. It isn't going to happen. He's just not capable, is he? And look at them, the pair of them, sitting there like a pair of oleaginous toads, working out what their latest scheme should be to screw over the people of Scotland. Anyway, Michael Matheson's predecessor admitted the NHS needs to reform the way it works. I don't think they need predecessor. Successor? Do they mean successor? That's terrible journalism, isn't it? Anyway, but the Scottish Tories say action is needed now to protect a service that's on its knees. Humza Yousaf handed Neil Gray a poisoned chalice when he made him Health Secretary, the Scottish Tories have claimed. Mr Gray took over from the disgraced Michael Matheson after he quit over his iPad self-fondling scandal. The First Minister was forced to shuffle his pack. Well, shuffle the pack, rearrange the deck chairs on the Titanic would be more of it. I mean, that ship is definitely going down. Anyway, he handed the key role to his friend, who had been the Cabinet Secretary for the Economy. He takes over an NHS facing a massive crisis, with record waiting lists and staff suffering from burnout and massive vacancies. They cannot fill the vacancies in the NHS in Scotland. And the only way they're going to do it now is to offer massive pay rises to encourage new staff to come in. But that'll mean that the existing staff will demand their pay rises, which means the whole thing becomes so unaffordable and top heavy that it will collapse. And the reason, of course, you have to offer these massive pay rises is so that after tax, they're earning the same and the equivalency of people who would work in the English part of the NHS. But on top of that, actually, you're going to have to offer a little bit more, because the stresses in the Scottish one, because they're so understaffed, are such that people are going off sick, going off with stress, going off, terribly overworked. And it's just, how can we put this? It's failing from every possible metric. There's not one part of the NHS in Scotland that can be said to be working. A&E waiting times are so bad. People are waiting up to 19 hours in the ambulance, in the car park, just to get into A&E. Your cancer wait times are terrible. Your outpatient wait times are terrible. No aspect of the NHS in Scotland is described as good. Don't even attempt to try and see a GP, and as for dentists, forget it. And this is the problem. You're getting a split in society because you're going to have those who can afford to go private, either through constant medical insurance each month, or for one-off things, will actually just go and pay the money and see a consultant privately at the cost of £400-500 in order to get treatment at all. And this is what's happening. Those who have will, but those who haven't got a clue, haven't got a chance, haven't got a future. Anyway, Scottish Conservative Deputy Health spokesperson Tess White urged Mr Gray to back her party's plan to increase the proportion of NHS spending going on primary care in a bid to deliver 1,000 extra GPs. And she added Neil Gray has inherited a poisoned chalice due to the dire workforce planning of previous SNP health secretaries. And they're going all the way back. It isn't just the last couple or three. It's 17 years of ill planning. It's left Scotland's NHS ill-equipped to meet the huge demands placed on it. Demands that will only increase, especially if many, many more new Scots come there, as per Humza Yousaf's wishes. Scots, of course, these new Scots who've never contributed a brass farthing to the system. Waiting times in A&E, he says, for cancer treatment are not just unacceptable, they're leading to needless deaths. People, and it isn't just cancer, but cancer's a bad one. There's cases where people are going with small niggles that could be treated quite easily or simply and efficiently, but by the time they actually get to see the oncologist, it's far too late and it's stage 4 and it's terminal. Because it isn't the few days or even a few weeks that you're waiting between realising something's wrong and seeing the specialist. It could be 6 months, 8 months, a year. And in cancer, a year could be a death sentence, and frequently is. And so the NHS, on its knees, falling apart, they're not putting the money in there. No, foreign embassies, marvellous. Brilliant idea. Sending Air Mars Angus halfway around the world, fantastic. People dying of cancer, well, it doesn't really matter, so long as Angus Robertson could be quaffing his champagne at 30,000 feet and going, oh, I'm doing rather well for myself, aren't I? That's their priorities. They don't care. Anyway, he also spoke of the importance of national treatment centres, and he was talking about Humza Yousaf. She was. Tess White was. But she said he forgot to mention that some of these are now being mothballed because of the freeze on NHS capital spending. Well, you've got the hospital up in Fort William, haven't you? That's been cancelled, and they're ready to break ground. And then the money was just pulled in the last budget. So don't stop, bang, nothing. And it isn't the only thing. There's walk-in centres that were supposed to happen. That's been cancelled. There's all sorts of things cancelled because they're not spending on capital. Because they just don't have it. But they can increase the spending on foreign embassies. So it makes you wonder, who are they working for? Because these foreign embassies are all filled with their chums and family members, and they're on good pay, sitting in a nice office in a nice city somewhere around the world, and you're paying for it. But your kids are going to die of leukemia, or granny is not going to get that hip replacement. But, that's their priorities. They are literally, they haven't got a clue. Anyway, Mr Gray was speaking days after research by the Institute of Fiscal Studies showed that the NHS in Scotland is treating fewer patients than it did pre-COVID, despite health spending and staffing levels rising. He said, I want to continue to drive down waiting times both for outpatients and inpatients, and for us to see continued improvement on accident and emergency waiting times. I'm sure you do, but until you and your boss, your slimy-toed boss, are willing to stop pissing money away on needless independence brochures, on spin doctors, on foreign embassies, and all the other tosh that you spend it on, and invest it into the hospitals, this isn't going to happen. And why? I'm sure people are asking, are you spending £5 million a year of public money on Ipsos Mori, designed purely to make you look like people follow you, want you, and support you, when the truth is completely the opposite? Answer that one. Coming up. No one in the SNP cares. No one in the SNP are capable of of sorting out this problem because their priorities lie elsewhere. They don't care about people. This is plainly obvious. They are obsessed with independence, and everything must be seen through the lens of independence. And if people die, well, that's unfortunate, but it's not something that they particularly care about. But it won't be them dying. It won't be their family members dying. Oh no, they're fully funded. They're all private medicine. In fact, MSPs get private medical insurance company cover as part of their remuneration package. Seems very weird. You know, they won't look after the NHS because, you know, they're better than that. That's only for the little people. It's not for the likes of them, the elite. Oh no, private medicine all the way from them. Anyway, there we go. You have to make your mind up when next time you come to vote, especially if you're an SNP voter and you're looking at your family members in a hospital dying through lack of care, assuming they can even get into a hospital. Meanwhile, know that those good people who don't care about you are all on private medicine. Till next time, stay safe, stay well. Do please hit that subscribe button, and I will speak to you later. Bye.